Next one is phases of the phases which occurs, okay, after injury or after trauma are important. Already discussed in oral surgery, but clearly I want to mention it again now. So whenever you have an injury or whenever you have an incision, okay, in the body, so what phases they regularly follow is phase 1 that we are going to have is EBB phase. After phase 1, after EBB, okay, because it extends over few hours. So once these few hours are done, the next phase that is going to come is flow phase. Okay, flow phase, which is basically is going to contain catabolic initially and anabolic in the later half. That is how the recovery is going to occur. Basically, it is 2 phases followed by at the end recovery is going to occur. The first phase is EBB phase. The second phase is flow phase. Okay, and followed by recovery is going to occur. And important point to be noted is changes related to the shock. Whenever you have a trauma, whenever you have an injury, what is going to happen? We have discussed, we are going to have shock. Okay, shock. All shock related changes are going to occur in EBB phase. Okay, so we'll check what are the important things that are occurring in this phase. Is first phase is EBB phase. Okay, right. It occurs from time of injury to 24 to 48 hours. Already discussed, shock is occurring here. What is shock? The most common shock is, most common type of shock is, the most common type of shock is hypovolemic shock. So whenever they're talking about shock, you should always think about hypovolemic shock until unless they are mentioning this is septic shock or this is neurogenic shock or something. The categorization is going to be different. But normally, if someone is mentioning a shock, the shock is hypovolemic shock because it is most common shock. Okay, so you will have hypovolemic shock. So what happens in the shock? What happens to the cardiac output in the shock? What happens to the cardiac output in the shock? Yes, cardiac output in the shock is going to decrease. A slight exception to this category is septic shock. Even septic shock also, there will be initial and lateral phase. Initial phase will be there. In initial phase, the cardiac output will be slightly increased, or the cardiac output is normal or increased. Okay, the only exception for shocks when you're talking about cardiac output is septic shock, where in the initial phase of septic shock, there will be increasing in the cardiac output or normal cardiac output is seen. But in the later half, the cardiac output automatically decreases. So the unique feature of every shock is decreasing in the cardiac output. Okay, so what happens apart from this? Your BMR is going to decrease, body metabolic rate is going to decrease, your temperature is going to decrease, and that leads to lactoacidosis. So all these things are going to take place in EBB phase after the injury or after the trauma. Clear? After the injury, after the trauma. And here I want you to make a few important points which are directly taken from B&L. Okay, the points are: number 1, catecholamines increases in this phase, EBB. Cortisol increases, aldosterone increases. Catecholamines increases, cortisol increases, aldosterone increases. Okay, your hypovolemic changes will be seen, BMR decreases, cardiac output decreases, temperature decreases, and lactoacidosis will be seen. Right. So once I am done with EBB phase, I told you the second phase. The second phase is flow phase. And second phase is a flow phase where you are going to have hypermetabolic changes. Metabolic changes. Metabolism will increase. Metabolism will increase in the sense there will be increasing in the BMR, there will be increasing in the cardiac output, there will be edema, the temperature increases, leukocytosis occur, oxygen consumption, because BMR increasing, oxygen consumption will be increasing, gluconeogenesis will occur. Gluconeogenesis will occur. I told you, flow is basically, initially it is catabolism for first 3 to 10 days. And from that, after 10 days to weeks, it is anabolic phase. So it is initially catabolic, later it will be converted into anabolic phase. Clear, right? Clear. Hope you are clear till this point. It starts EBB and followed by flow. Flow is initially catabolic and followed by anabolic. So what happened in this catabolic? What is catabolism basically? What is catabolism basically? catabolism is basically breaking. Okay, right? So what happens here? Increasing in the counter-regulatory hormones takes place. Okay, increasing in the counter-regulatory hormones take place. What are these counter-regulatory hormones? The counter-regulatory hormones are increasing in catecholamines. Very unique thing is you need to make about increasing in the insulin levels, increasing in the glucagon levels. So apart from this, you have increasing in the inflammatory cytokinins also. So particularly cytokinin 1, interleukin 1 and interleukin 6 and TNF alpha are going to increase. So all these which increases are primarily increasing the fat and protein metabolism. Okay, metabolism will occur. Metabolism is nothing but breakdown. Okay, so fat protein metabolism occur whenever fat and protein which are present in the body are breaking down. They are going for metabolism. There will be loss of muscle weight. There will be loss of muscle weight. So the patient is going to have weight loss. So as we already know that protein is a combination of amino acids. So whenever your amino acids and everything are digested, your nitrogen excretion takes place. Okay, right? So the main motto of this catabolic reaction is increasing in the metabolism of fat and proteins lead to weight loss, lead to increasing in the nitrogen excretion.